Eddie here. Still insured in theory. No hello, because I just found out my affordable health plan covers me the same way a napkin covers a gunshot wound. I'm sitting in a CVS parking lot, learning that my monthly payment does not actually purchase medical care. It purchases access to a complicated, emotional experience. I always thought all that college, maybe too much education, was going to land me in a Manhattan office. Instead, I'm in a black 2015 Honda Civic, Googling whether covered means financially ruined. A little slower. People hear affordable health plan and think, great, now healthcare is affordable. That is adorable. That's like hearing budget airline and assuming your spine is included in the ticket price. An affordable plan does not mean affordable care. It means the monthly premium is low enough that you don't immediately pass out. Everything after that is a scavenger hunt, designed by accountants and demons. Let's start with the premium. A premium is the amount you pay every month, so the insurance company can continue knowing your name. That's it. It is not healthcare. It is not healing. It is not medicine. It's the cover charge to enter a nightclub where nobody wants to help you and the drinks are still $18. So when people say, at least you have insurance, I'm like, yes, technically. In the same way owning a gym membership means I could, in theory, become a different person. The premium is not the solution. It is the subscription fee for being allowed to begin. The paperwork. Then comes the deductible. Ah, yes. The deductible. The deductible is insurance saying, before we help you, we need to make sure you're serious. It's the tutorial boss of American healthcare. You pay every month for the privilege of eventually paying more before the plan becomes emotionally available. That's the joke. People think insurance kicks in when you get sick. No. Insurance first checks whether you've suffered correctly. So your plan says, good news, you're covered. Then you actually need care and it's like, wonderful. Please pay several $1,000s to unlock basic compassion. That's not coverage. That's a side quest. And after the deductible, because humiliation apparently needs sequels, you get copays and coinsurance. A copay is a smaller fee that exists, so the insult can feel casual. Coinsurance is even better. That's when the bill looks at you and says, we're all in this together. Mostly you. Every part of this system is designed to make you ask the same question, in a slightly different tone. Wait, I still owe what? Premium, deductible, copay, coinsurance. At this point, healthcare is less a service and more a Russian nesting doll of invoices. You open one bill and inside is another bill. Inside that bill is a smaller bill wearing glasses. And then there's the network. The network is a list of doctors you're apparently allowed to disappoint with your symptoms. Because it's not enough to be sick. You also have to be geographically and contractually sick in the correct way. You could find a doctor. You could find a good doctor. You could find the only doctor with an appointment this decade. And insurance will still be like, wrong wizard. Out of network is one of my favorite phrases in America. It sounds so technical, so professional. What it really means is, congratulations, your suffering has occurred in the wrong spreadsheet. Here's the part people miss. If they've had a normal job with normal benefits and a chair that belongs to the company, gig workers don't just pay for healthcare and money. We pay for it in time we cannot bill. If I lose half a day in urgent care, I'm not just paying the copay. I'm also not driving, not delivering, not invoicing, not earning. So the real cost is the premium plus the deductible, plus the copay, plus the prescription, plus the hours lost, plus the weird stress rash from being on hold with customer service. The system doesn't just ask, "Are you sick?" It asks, "Can you afford to stop producing?" Long enough to prove it. And this is why the word affordable makes me laugh. Affordable for who? For a policy brochure? For a panel economist? For anybody who says consumer choice without getting hit by reality. A cheap plan that collapses on contact is not affordable. It is decorative. So read the deductible, read the network, read the fine print, and tell me the most disrespectful thing your health plan ever refused to cover.